so I'm approaching this patient's room. I do show a physician order for an SVN treatment of levalbuterol. I'm checking the patient's chart to see any patient history. I do show that he's been complaining of shortness of breath. I'm checking to see if there's any lab work, any CBCs, chest x-rays. Don't show any in the chart. He was just recently admitted. There hasn't been anything that's been added just yet. I'm gonna go ahead and gather my supplies. Go ahead and get my levalbuterol, an SVN, some alcohol wipes, some normal saline. I'm gonna go ahead and wash my hands. Do that for 15 seconds. Dry my hands. Go ahead and foam in. And glove up. Okay. Go ahead and knock on the door.
Hello.
Hi, Mr. Smith. My name is Gama. I'm your respiratory therapist for today. How's your breathing?
I've had better days. It's pretty rough right now.
I can imagine, but I'm here to help you out with that breathing. Hopefully make you feel a lot better by the end of your treatment, okay?
Excellent.
Now, can I just have you say your first and last name, please?
Yeah, it's John Doe.
Perfect. And your date of birth?
09/20/1990.
Perfect. Definitely have the right patient. Okay, Mr. Doe. Now, I do show that you've had an SVN treatment before for albuterol, and we had a little bit of an adverse effect there with your heart. You became a little bit of tachycardic, okay? So the doctor has prescribed levalbuterol this time around, which will actually help you with opening up those lungs so you're able to breathe a lot better since you've been complaining about shortness of breath. And but it hopefully won't have the same effect on your heart, okay? Now I'm gonna go ahead and take your vitals and place the pulse oximeter on your finger really quick here. Now if you can go ahead and just breathe normally for me. Good job. Okay. I'm going to go ahead and listen to the back of your lungs. There we go. Now normally I would listen to 6 different points on the back of the lungs, but because the dummy's a little bit hard to push forward, I only listen to the apices of the back. And I'm going to go ahead and take the pulse now. There we go. Now, as I'm taking the pulse for 30 seconds, I am also taking note of his respiratory rate. Okay, perfect. I have a pulse of 80 and a respiratory rate of 16. So I'll jot that down. As on top of that, his saturation levels, which I showed to be at 92%. Okay, I'm gonna go ahead and set up the equipment. pour in the levalbuterol and the saline. Set it up to the mask. Connect the wiring. Now I'm going to be connecting the wiring to the oxygen source. And I'm going to go ahead and set it up to 8 liters. Okay. Now, Mr. Doe, I'm going to go ahead and place this over your face. This is going to go ahead and make sure that this treatment, you're able to breathe it in and disperses through your lungs efficiently. I'm going to go ahead and make sure that this is nice and tight, not too tight though. Just let me know if that feels comfortable. Get a good seal over the nose. Now, as you're breathing in, go ahead and, if you can, hold that breath for anywhere to 1 to 3 seconds to make sure that this medication disperses a lot further down into your lungs, okay? Want to make sure that we're able to affect that tightness in your chest or that shortness of breath a lot better. Now, at this point, 5 minutes have elapsed. I would go ahead and take his vitals again by checking his respiratory rate, his pulse, saturation levels, and I'm also checking for his breathing sounds as well, anterior and posteriorly. Now, it's important that I check his pulse this time around because he did have an adverse effect to albuterol in the past. So I want to make sure that the levalbuterol is not having the same effect. So I'll go ahead and jot down my vitals. Now, the doctor did prescribe levalbuterol, which I went ahead and gave him a 1.25 milligram dose. Came in 2 milliliters of solution. I did have to add 1 milliliter of normal saline to be able to fill the 3 milliliter requirement of this SVN in order for it to run efficiently, or for it to be able to run. I will go ahead and run it for 8 to 10 minutes. Set it to 8 liters of oxygen to get appropriate flow. Now, the way that levalbuterol works, it is a derivative of albuterol, and it works by affecting the beta-2 beta-2 receptors in the lungs, and it go ahead and relaxes the smooth muscles in the airways, everywhere from the trachea all the way down to the terminal bronchioles. Okay, and I do hear that the baffle has sputtered, which means that the treatment has concluded. I'll go ahead and take it off Mr. Doe. Okay, Mr. Doe, good job. Let me go ahead and just have you lean forward. Put this to the side. And at this point, I'm going to have the patient cough a couple of times. Thank you, Mr. Doe. Now, I'm going to go ahead and take your vitals one last time. And I just have you breathe in normally. Once again, I'd listen to 6 different points in the back. I'm only able to listen to 2 on this patient. Breath sounds have improved. Go ahead and take the pulse. And just check the chest rises for respiratory rate at the same time. Perfect. Now his pulse did increase to 90, but it's still within good range. So levalbuterol did have some effect on the heart, but not as adverse as the albuterol had in the past. And his saturation levels have improved to 95%. So the treatment has definitely worked. I'll go ahead and clean up my equipment, make sure that it's ready for the next patient. And okay, Mr. Doe, we are done with your treatment today. How's that breathing?
It's a lot better.
Glad to hear that. Now, do you have any questions for me?
Yeah, when am I gonna see you again?
Good question. Well, actually, the doctor did prescribe for you to have this SVN treatment with levalbuterol every 4 hours. So I'll definitely be back in this room within the 4-hour mark. Now, if you were to need me anytime sooner than that, you can go ahead and press this button here, and it will call your nurse. She'll go ahead and page me and let me know that I'm needed, and I'll come here as soon as I can, okay?
Awesome.
Anything I can get you, perhaps?
Nope, that's it, man.
Perfect. Well, thank you very much for your cooperation, and I'll see you within the next few hours, okay?
Okay.
I'll go ahead and gather my supplies, take them out of the room, dispose of them, remove my gloves, dispose of them, foam out, and I get to chart what I did with this patient. So I chart for Mr. Doe the date and time, the modality, the type of medications that were given, the dosage and the strength, any pre, post, and mid vitals as well, and the patient tolerance, which this treatment of levalbuterol was tolerated a lot better than he was able to tolerate albuterol in the past, and any other pertinent information. And that concludes the treatment.